Hello, today I'm going to talk about infective endocarditis. This is an infection of the heart, and to be more precise, it affects the endocardium of the heart. The most common cause is Staph aureus, which can enter via peripheral lines, central lines, or the skin itself. Historically speaking, Streptococcus viridans used to be the most common, however, this is now no longer the case. Staphylococcus epidermidis is the most common cause soon after prosthetic valve insertion, that is within 60 days. After 60 days, Staph aureus is the most common cause. Other causes include strep bovis, seen in the elderly with bowel cancer, and non-infective causes such as lupus. Risk factors for infective endocarditis include male, elderly, the use of IV drugs, and this can cause right-sided infective endocarditis, poor dental hygiene, structural heart disease, and HIV. And for infective endocarditis to occur, two factors must be present: the presence of organisms in the blood, and two, abnormal cardiac endothelium, which promotes growth. Of note, aortic and mitral valves are most commonly affected. And which side of the heart is most commonly affected? Well, this tends to be the left side of the heart due to the increased turbulence of the blood. And what is the presentation? Well, any fever and new murmur, you must think infective endocarditis until proven otherwise. You can also get ulcer nodes and giant relations, as well as rough spots in the retina. The tests include blood tests for FBC, ESR, CRP, blood cultures. You need to do 3 sets from 3 different areas with at least 1 hour between them. And a urine dipstick, which would show microscopic hematuria, and also a chest x-ray, an ECG, and an echo. And what is the most common reason for negative blood cultures? Well, the most common reason is that you have treated the patient priorly with antibiotics. Duke's criteria, this can be used to diagnose. So the major criteria is that typical microorganisms from 2 blood culture sets are persistently positive blood cultures, and also endocardial involvement. This is most commonly picked up on the echo. And the minor criteria is if they have a heart condition, IVDU, fever, vascular phenomenon, immunological phenomenon, and microbiological phenomena such as blood cultures that do not meet the major criteria. So in order to be diagnosed, it needs to have 2 of the major criteria, or 1 of the major criteria, 3 of the minor, or 5 of the minor. So the treatment, if it's an empirical native valve, you use amoxicillin and gent. If prosthetic, you use vancomycin, gent, and rifampicin. And should prophylaxis be given? No, we do no longer give prophylaxis. So what is the indications for surgery, infective endocarditis? Heart failure, not responsive to antibiotic therapy. We would also have persistent bacteremia would be another indication, and also if it's fungal endocarditis, that tends to be an indication, and recurrent ambuli or ambulus after treatment. So thank you for listening. That concludes my presentation. If you liked this video, please don't forget to hit the like button and subscribe to the channel.